Hello, let's talk about sitting down after you've had a hip replacement. Typically, if you've had a posterior hip replacement, you want to sit on a higher surface seat. Okay, you don't want to sit on a very soft couch. A posterior hip replacement, how you know that is the scar is on the back side of the hip. If you've had an anterior hip replacement, sitting on a low seat is not that much of a problem. It still may be hard to get off of a low seat, but you don't run the risk of dislocating the hip as you do with a posterior replacement. So the anterior replacement is going to be on the front side of the thigh. If you're going to sit down on a sofa, and let's just assume that my right leg is the one that's been repaired, surgically repaired, and I'm here, remember from my last video, if we're going backwards, it's good leg, bad leg, walker. Good leg, bad leg, walker. Good leg, bad leg, walker. I want to touch whatever I'm sitting on, I want to touch it with both legs before I decide to sit. Once I get to the spot and I'm touching it, take a step forward with the surgically repaired leg, reach back with the opposite hand and lower yourself down to the sofa or to the chair, and then rest comfortably. Getting up is going to be very similar. You scoot to the edge. You can bring the leg out forward because having the leg out forward puts less pressure on it. Lean forward. Don't pull from the walker. Lean forward from the couch and push from the couch and come up. Walker, sore leg, good leg, walker, sore leg, good leg. I hope that helps.